Hãy để mỗi lần tắm là một lần chăm sóc cho làn da của bạn với sữa tắm cá ngựa Our Turmeric Perfume Shower Gel, một sản phẩm từ nước Đức, được chiết xuất từ các loài hoa thiên nhiên, nhiều loại vitamin và protein. Sữa tắm cá ngựa không chỉ làm sạch da mà còn dưỡng ẩm, mang lại một làn da mịn màng, căng tràn sức sống. Với hương nước hoa quý phái lưu lại suốt 24 giờ, sản phẩm từ thương hiệu Our Turmeric đã chinh phục hàng triệu người dùng tại châu Âu. Tại Sydney, sản phẩm hiện đang được bán tại siêu thị Nam Phương ở Cabramatta và siêu thị Cycle ở Cali Heights. Để làm đại lý phân phối, xin liên lạc đài VTA qua số 0452 067 535.
Có một loại nước mắm thuần khiết, sinh ra để làm nên sự khác biệt, gói trọn tinh hoa của biển cả, đánh thức hương vị đậm đà thượng hạng, đẳng cấp, sang trọng, là món quà tình thân ý nghĩa để luôn nhắc ta nhớ về cội nguồn. Nước mắm Hoàng gia, tinh hoa đất Việt.
Nước mắm Hoàng gia hiện nay đã có mặt tại tất cả các tiểu bang trên toàn quốc Úc Châu với 3 kích cỡ khác nhau, bao gồm 250ml, 500ml và 750ml. Tại Melbourne, nước mắm Hoàng gia đang được phân phối bởi công ty Oxford Foods và bán lẻ tại các siêu thị và nhà hàng. Mọi chi tiết xin liên lạc anh Tony Bùi 0481 177 996.
Hi everyone, welcome to the Sunday show of VTA, Viet TV Australia, and today we welcome back Dr. Amy Leung from 15 Dental in Candy Vale. Thank you for joining us, Dr. Amy Leung.
Thank you for having us and welcome to the audience to our Sunday show.
Well, everyone, today we're talking about a topic that many of us try to share. Yeah, we try to share. There is a lot of parents got their kids, got the children who always wet their bed. So, can you share your experience or what you have something to share with us about this, Dr. Emily?
So it causes a lot of embarrassment, and a lot of families actually suffer from this condition, and they don't want to share because it's highly embarrassing.
Yeah, embarrassing.
But so I'm willing to share a very personal story. It regards to my son, who at the age of say 13 was still wetting the bed.
Oh, really?
And he had to wear adult nappies, diapers, because the baby nappies were no longer fitting him. It caused a lot of anxiety because he couldn't go to camp. Because when he went to camp, he would stay up late because it meant that if he fell asleep, he would wet the bed and his friends would find out his secret. So he would stay up the whole night, and the next day he couldn't enjoy the camp activities.
Oh, right.
He could never go to sleep over because, of course, if he wet the bed at the friend's house, the secret would come out.
Oh, yeah.
So it caused him a lot of stress, and even at home, I would be always having to wake up because it was such a large volume that even with the nappies on, he was wetting his clothes and his sheets.
Poor little boy. Poor little boy.
Yeah, so I took him to a lot of specialists, several ear, nose and throat, urinary specialists. In total, maybe 30 specialists 30 different specialists, and they suggested different options, including expansion of his palate. So we put a device in and we crank open his palate. Because they actually suspected that he had a narrow airway, and that didn't work. And then they said his tongue was tied, so therefore we need to release his tongue. So we cut his tongue with a laser. And then after that, they said his tongue is actually sitting too low. He needs to go to a speech pathologist. So I paid for him to have speech pathology where they train his tongue to sit higher. And we kept going, around like all the time. And eventually, I just people were accusing me of what we call Munchausen by proxy almost. It's like a condition where the parents invent the condition in the child so that they would attract attention. Because they said, obviously, if he had a problem, he'd be wetting himself in the daytime. He knows how to control his bladder. It's only when he go to sleep Now, there is a lot of reasons why a child would continue to wet the bed beyond what is a reasonable age.
Wow. Okay.
Yes.
So I really hope that, our topic today will help a lot of parents out there who have their children wetting their bed, until like Ami said, until the age of 13. And that's, I have the answer for the question why the supermarket selling the nappies, up to 25, 30 kilos.
Yeah. So the most worrying condition with regards to bedwetting is actually something called sleep apnea, or we call it OSA. So obstructive sleep disorder, right? So this one, I think Dr. Victoria has spoken about briefly. So signs of OSA in a child is grinding their teeth.
Oh.
So like crunching, grinding.
Hang on. So that's something...
Yes, it's all tied in.
Relate?
It's all to the bedwetting, yes.
Really?
Yes. So OSA, or sleep apnea, is short, actually can lead to bedwetting, and I will tell you how. So basically, let's talk about the signs first. So the sign is grinding in the teeth.
Grinding,
Yeah, so like kids don't really have stress. Why would they be grinding? So grinding is a response, a physiological response to like lack of oxygen. So the grinding stimulates, so then the brain starts breathing. So they basically stop breathing, the brain gets activated, and then they grind, and then suddenly they
Right. That's something interesting. To be honest, my son's also grinding his teeth when he's sleeping, and I think maybe he got a dream, and then he doing that, to respond, in his dream.
No, it's got nothing to do with the dream. The grinding is a physiological response to a lack of oxygen and airway problems. The other thing that they do is snoring. So snoring, and if you witness episode of where they have what we called like they stop breathing. So you actually hear it's like they breathe and then they go snort, snort, snort. They choke. We call that the choke. So choking in their sleep. So that's an apnea, and people actually count that. So they count it to assess whether it's mild, severe, moderate, and depending on what it is, it can influence the treatment, because everyone wants to know, okay, we know the cause, we know what's happened now, what do we do? So the treatment would depend on its mild, if it's mild, moderate, or severe. If it's mild, we can do some simple things like, for example, my son, we expand his palate. They cut the tongue, they do the oral myology, and that will actually have enough airway, because it's all about the airway. Now, if it's moderate, they can actually look at things like removing the adenoids or the tonsils, tissues, because it's all about creating the airway space. In the worst case scenario, they do put kids on a CPAP machine. So it's this big contraption which helps the kids breathe. We are very reluctant to put developing kids on that sort of device, because it actually affects the growth of their face and their whole jaw. But what is the consequences if we do nothing, Ken? So the consequences is that they are stunted, they're short. Because lack of sleep and lack of oxygen to the brain will cause shortness. So they will be very short stature. The other thing is IQ. Their IQ is very low. They're not smart. Because sleep is what makes the brain grow, and quality sleep, we're talking about what we call REM. So it's for deep sleep, not just light sleep. So REM, you will see, this is where we have dreams. And then you can see the kids talk in their sleep.
Right. Things getting complicated now. I remember we started the topic with the, kid wetting their bed. And now, that leads to a lot of troubles later on. Snoring, teeth grinding, and lack of oxygen caused, shockness, low IQ. There's a lot of things related. Yes.
And the other thing is, it puts a lot of strain on the heart. So generally, people with this sleep apnea, if it's not treated, they have a very short life. They die young. And that happened to my uncle. He died at the age of 40. Because every time they go to sleep, they die in their sleep 40 times. So every time they go snort, 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 snore, it's the body trying to breathe. And they actually, over the year of 30, 40 years, their heart give out. And then you see it, these people have I had a friend whose brother died at the age of 30 from undiagnosed sleep apnea. My uncle died at the age of 40 from diagnosed sleep apnea. So it's a very serious condition.
Wow.
And it comes down to one hormone. This hormone is produced when you have quality REM sleep. It's called antidiuretic hormone. So the word is antidiuretic. Antidiuretic is to do with the bladder. So that explains why a child would be bedwetting. Because without this hormone, the bladder cannot productively produce urine and retain it. But the child that have this condition doesn't have enough this hormone, this ADH hormone.
I never imagined that, that the simple symptom of wetting bed, like that's the product of, very complicated process,
We call this in dentistry smoke alarm.
Smoke alarm.
Yeah, smoke alarm. So it's before the fire comes. So we always ask the question, does your child grind in their sleep? Yes, grind their teeth. Does your child snore? Have you ever witnessed him choking, like trying to choke, like he's swallowing something? Yes, and the other way is we also look inside the mouth. So when we come to do the examination, we can actually check his adenoids and tonsils and check his airway to see if there's any room.
Right. Some people just simply think, okay, maybe the kid, wetting bed because they're very deep sleeper, or they sleep very deeply, and then like the parents just wake them up, to ask them to go to the toilet. And that's the way, to have to try the bed.
No. I've been told by 30 different specialists, don't do anything, just leave him, he'll grow out of it. But when does he grow? He's already 13. Is he going to be like 18-year-old, or he get married and he have to like wear nappies to bed? I refused to give up on my son, and I kept... fortunately, he didn't have sleep apnea. I'm very thankful because it's a horrible condition to have. He didn't have sleep apnea. It turned out to be a very simple reason, and he was constipated. So once we solved that, his bedwetting went away. So somebody along the way listened to me. Out of the 30 doctors, only one doctor, he saw me like with tears in my eyes. I begged him, please help me. I can't live like this. I can't, like, my son can't live like this.
Right, I know.
Then he listened, and he really diagnosed him as he have a blocked bowel. So once we cured that, the next day he stopped, and he never wet the bed ever again.
Really?
Yeah. Now he's going to camp.
Okay.
He's sleeping over.
That's something I would say miracle.
Yes.
So let's talk about the blocked bowel. So what the cause and how that blocked bowel, and how we cure it and how we treat it.
So it was picked up by. So I actually, because of my son, I went and did a diploma of sleep apnea, like OSA, because I wanted to learn more, because no one was listening to me. And if people can't help him, I will help him. So I went and studied for my son. It wasn't for money. It wasn't to make money. It was a personal journey to save my son.
You're beautiful, Mom.
Yeah.
You're beautiful.
So then when I did the study, I started to look at all the boxes, and it didn't make sense because my son didn't snore. My son didn't grind his teeth.
Yeah.
So I said, he doesn't have the symptom. He just have one, which is bedwetting.
Yep.
So I kept asking, and I said so I went to this amazing doctor in Liverpool. His name is Dr. Jim Papadopoulos. And I asked him, can you just please listen to me? And he actually listened. And I said, this is what I know, and this is what I don't know. So the list of things I don't know is longer. And I said, can you help me fill in the blank between what I don't know and what I know? I said, I know that he has one symptom of sleep apnea, but he doesn't have the other 5 symptoms. So he said, well, let's see what is the cause, because he goes, bedwetting actually caused by 5 different things, not just one. And he said, let me look. And when he had a look at my son, he actually picked up, he have gastric reflux. So he have a weak sphincter up in his stomach here. So every time he lies back, the acid comes up and goes to the back of his throat. And it actually burns his throat, and it causes him to be like uncomfortable. So every time he sleeps, he's tossing. He's turning in his sleep. He's very uncomfortable. So when I watch him sleep, because sometimes I can't really sleep, I'm worried about his bedwetting, so I come check on him. And I see he's tossing and turning. And then Dr. Jim actually ordered a sleep study at the hospital. So we brought him there to the hospital. They put wires and they put a video on. They film him the whole night. And they have these electrodes into his brain and they monitor his heart and his breathing. And they film him. And the next day we watch it together. And there is my son tossing a lot. And I said, how come he sleeps so uncomfortable? So then he said he had the burning. So we give him some medicine to keep the acid down. And then we went back to the hospital, we filmed it again, and he actually slept peacefully like a baby. So the medicine helped him have a better sleep because it keeps the acid down. And the added to that is if we didn't diagnose it, that acid would have caused him to have what we call esophageal cancer. So cancer of the throat, the acid constantly burning, he would have had cancer and probably died by the age of 30 if it wasn't diagnosed.
Wow.
So it's called gastric reflux.
I'm not an expert. I'm not a health expert, you know, especially, you know, in such particular topic or such particular thing. But I would say that very, very, very concerned.
So when he went to fill out the bowel of my son, the bowel is sitting right next to the bladder. The bowel is completely hard like a rock. In the normal one, like yours and mine, is soft like a pillow. But his is like a rock inside his stomach. And he goes, come feel this. And then he sent me to a specialist, and the specialist put him on a regime of medicine to clear out the blockage from by that time he's 13 years of blockage. This poor boy been suffering since he was a baby. And we clear it out, and within a few days, the bedwetting stopped. He was a happier child. You know, my son is now like 182 centimeter.
Really?
He's like, he get things off the shelf for me. Remember I talked to you about his height?
Yeah.
His IQ is off the chart. Like he did the math test for the, you know, when he entered year 7. Out of 100 questions, he get 1 wrong. Yeah, so like his IQ is high, his thing. I literally have a new boy in my house now. You know?
Wow.
Yeah.
Yeah. I can't imagine like what you did before. You have to wake up and wet the bed, and the bed is wet, and then you have to change all the cover, all the sheet, or the bed sheets, or all things hard work. And of course it's not a fresh smell too. Yeah.
Just sometimes we get to the point we have no more sheets in the house. We just put a towel. We just get a towel, put it, and then we just roll it and wash it because we just have no more sheets.
Yeah.
Yeah, it's too much work.
That's too much work. That's too much for parents, you know, who got their children got the such symptoms like this, and I hope, you know, like this topic will help you there, you know, to find a solution. And what's your advice then, if parents? Back to the topic.
I would say advocate for your child, and that means like if everybody say your child is fine, and you feel in your heart that your child is not fine, keep asking the question, keep taking him until someone listens. And the other thing I would say to the health specialist is like, please take extra care when you are diagnosing someone's child, because you don't live in our home. You don't actually feel our pain. It's, you know, any parents who have a child who's bedwet, they know the shame. The shame of like, they can't go to camp. They can't go to a friend's house and sleep over. They can't, and they go to school and they smell like wee-wee. You know, their clothes, they smell it, you know. And it's a lot of shame that go with it.
Right. I think I would say, I personally learned a lot from Amy's story, you know, like number one, you know, being, you know, along with your kids, you know, being friends with them, you know, like, and then, you know, like, this is a very long process, right? This is a very long term, I would say, commitment, right, to find the solution.
So, yes, anyone that knows me and comes to my clinic, they know how passionate I am, because they said like, oh, we go to the dentist all the time. They just clean the teeth. You're the first person that is looking up his nose, looking down his throat, checking his tonsil, checking his adenoids. Like, and then you're asking me silly question. Does he grind his teeth? Does he snore? Does he this? Does he that? I just like, if I can save one child, if I can save one parent from what I went through for 13 years, it just like makes like it worthwhile, you know? Yeah.
Really, and I would say, You're a beautiful mom. You're a beautiful mom.
Yeah.
You study just for your son. The
Yeah,
diploma,
I mean, like, you can't really make, like, we give free diagnosis. Like, when I do a checkup and clean, I just have a look for free, you know. And if I see anything, I refer. And I just like, look, if this helps you, here's the number of Dr. Jim Papadopoulos. You know, the name is hard to spell. Maybe look it up, but, you know, he's down Liverpool. Just go. And if it's nothing, it's nothing. But if it saved your child's life.
Really?
Yeah,
really?
if it saved your child's life, it would make that trip worthwhile.
Well, I would say we start with a very small topic, you know, that, you know, like a lot of parents struggling, you know, with, you know, cleaning the bed after their children wet the bed.
Yes.
And we end up with, you know, big story from her personal experience, her personal story about her son who got, you know, like the symptom of, you know, wetting his bed.
Yes.
But now it's gone.
Yes.
That's a miracle.
I think for him, sometimes I worry that that the fact that I share this, it would embarrass him. But I ask him always, I said, do you mind if I share it? And he's like, no, please, Mum, share it. No, because I don't want anyone to go through what I went through. Yeah. And he hugged me and he said, thank God for, like, keep going, keep looking for the doctor, keep trying. Yeah.
Thanks him to, you know, to allow you to share this story, because I would say this will help a lot of parents, a lot of kids who always feel embarrassing to share this, you know, like they keep it very personal.
Yes.
You know, keep it private.
Yes.
And the more you keep private, the more you keep it personal, you know, like the more, you know, I would say the less people got a chance to be cured.
Yes. Let's share the knowledge and let's help more people.
Right. Yeah, I would say thank you for, you know, for working so hard, that a long journey is, you know. I did wonder how long from you realized that your son got that symptom until it finished, until it ends.
It started when he was 3 years old.
All right.
The reason was that when he was 2, he was already dry. I trained him. He had no nappies. And suddenly, 1 year later, he started wetting the bed. So I was very surprised. I thought maybe he had some cancer or something wrong, because when he was 2, he stopped wearing the nappy to bed. He was a good boy. Good boy, yeah. So he used the toilet and then he brushed his teeth and he'd go to bed. He'd sleep till the morning. And then when he was 3, he started wetting the bed, and it was frustrating for me. So that's when I went to get help for him. And that journey took from 3 years old until 13, 10 years. Because every year I would come up with, no, I haven't tried this one. I haven't tried this one.
and that symptom finished when your son's, how old your son?
14.
14,
yeah. So at the age of 14, he was cured.
That the long journey
Very
of
long.
10 years,
Yes.
of 10 years of working hard patiently.
Yes.
Of working patiently.
And I wish I had met Dr. Jim Papadopoulos when he was 4 or 3, not now. Yeah.
And I would say after this show, I think if, you know, parents out there who got a similar symptoms, you can save the time, and hopefully we, you know, like we give you a guide or a solution, or at least advice, you know, like to shorten, you know, the time, and, you know, to find a better solution for your children out there.
Yes.
Instead of, you know, spending like almost 10 years.
Yes.
Like Dr. Amy Leung for her son.
Well, I just want to say thank you, because you're giving me a chance to tell my story.
I would say thank you
and
to you.
Also helping
thank
parents.
Thank you to you. Thank you for your son. You know,
and thank you for the show.
Yeah, who allow you to share his own story. And I know it's that very private.
Yeah, very private.
Very private, very personal. But, you know, like I would say, he should be a doctor later.
Well, he's doing it at the HSC at the moment, was he? But I have high hopes because he's cured. He's doing well.
Yeah. I never imagined that our show end with lots of useful information like this. And thank you for sharing us. And yeah, we hope to see you back next week.
All right, looking forward to it.
Thank you everyone for watching, and we're going to see you again next week.